And now we're at a point in the program where we want to showcase our work and accomplishments over the past year. And what this really is a highlight on what we as a community have been working on together. You are on the front lines of healthcare and standards initiatives, addressing challenges firsthand. You connect with us, you work with us to ensure LOINC and all of our standards work is responsive, current, and continues to evolve. We've prepared a short video for you that showcases our accomplishments in the past year, only made possible through your contributions. Well, we hope you enjoyed the video. Give yourself a round of applause because we have accomplished a great deal this past year. Again, only made possible through your contribution. As you know, there is a lot of work underway in the various committees, and we look forward to a productive and, most importantly, an impactful year ahead. All right, moving on. As always, strategy is critically important to any organization's intended direction, and that is true for us as well. And as such, we want to bring you up to date on our strategic initiatives, including the 2020 strategic plan and the redesign plan for 2023. In 2020, we had 4 overarching strategic areas of focus, which include increase the understanding of LOINC, develop an adaptive staffing model, help LOINC the standard, as well as our volunteers, that's many of you, and team members, function and serve in leadership and innovation roles in the larger community. And this last focus area is to enhance innovation and technology. And here are some of the highlights of our progress. An increased understanding of LOINC. We increased engagement and enhanced communications through a new community forum and a redesigned website. And we also provided more touch points with stakeholders and users via webinars. And that was a lesson learned because of COVID. Looking at staffing resources in response to a need for executive level leadership in the LOINC and health standards area, the executive director position was filled in 2021 when I joined in January of that year. Also, we are building out the team in response to the needs in the healthcare and the standards community. Today, there's a requirement for formally trained informaticians, terminologists, and software engineers, which is different than our previous model where we would hire and then train on the job. In leadership and innovation, our committee chairs, volunteers, and our team members are leading the way in HL7, in SHIELD, or the Systemic Harmonization and Interoperability Enhancement for Laboratory Data Initiative. We also joined the JIC, or the Joint Initiative Council for Global Health Informatics, and some of our colleagues in that initiative are here today. We appreciate that. We have a collaboration agreement in place with SNOMED International that outlines an approach and solution for the coordinated use of LOINC and SOMID-CT that is intended to be transformative and will be transformative for interoperability. In innovation and technology, from the terminology perspective, we've remained at the leading edge of healthcare trends and developments, as evidenced by the tremendous amount of collaborative work with our national and international colleagues to respond to the COVID-19 pandemic. And many of you in this room today who worked on that with us. We also worked with HL7 on the Gender Harmony Initiative in adding SOGI content to LOINC, as well as working with the National Kidney Foundation and the American Academy of Neurology on the new EGFR calculations that now exclude a race-based variable based on updated clinical guidelines. With respect to technology, we added new features to our FHIR terminology service. We developed a search LOINC tool and a hierarchy browser. These are just some highlights of our 2020 strategic plan. There's much more that we can talk to you about. We're happy to do that during our break. Oops, sorry about that. And as we all know, a strategic plan is ongoing and dynamic. It is never static. And as Harvard Business Review states, most successful strategies evolve and pivot away from their original strategic plan, and more than 90% of them do so. And that's what we did for 2023 in order to be responsive in an effective way to healthcare trends and standards community needs. These are our 4 focus areas. I'll just highlight a few high-level objectives from each of them. We want to continue our strategic role, this is in the upper left-hand corner, in health data. And that includes things like continuing to advise on US CDI, which is a critically important objective. And we also plan to assemble a strategic advisory council for LOINC that is made up of a diverse group of thought leaders who advise on strategic issues that require specialized expertise. We are excited about launching this, and this is about LOINC the standard. Okay? In innovation in technology, we'll continue to modernize and update our tools and infrastructure as healthcare and informatics trends demand. And the work on our concept model and ontology will expand as well. The integration with Regenstrief focus is more of an internal goal, yet relevant nonetheless. Our unit, which stewards LOINC and UCOM and leads other data standards work, falls under the Regenstrief umbrella. And for that reason, we need to remain effective business and strategic partners, aligning key mission and business goals. And like any other organization, we have to remain financially sustainable. And that's in order to continue the very important work that we all do together. And this includes establishing new grant contracting research opportunities, sustaining the ones that we currently have, and it also means exploring other types of opportunities. And one such example would be establishing new programs for education or implementation support. So this concludes our strategic overview. I am told that we need to move to break.